Hello, listeners. You are listening to The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio, where we go inside our community's experience with the drug epidemic. We're coming to you from Stanton, Kentucky, a small town nestled at the western foothills of Appalachia. And we have a really cool episode for you guys today. We are joined by a support group from a Nar-Anon group out of Richmond, Kentucky. They're all residents of Estill County and Irvin. And this group of mothers joined the show to share what their experience has been and how they found that support with each other to be helpful. And we ended up having a really long conversation here, so we actually made it a two-part episode. So this week you'll get part 1, and then next week part 2 will be released. Well, we've got a lot of ground to cover, so let's go on and get into it. I'm your host, Nate Brooks. You're listening to The Local Lens. These are our people, using our voices, telling our stories, because no one sees it like we do.
My name is Marty Hackworth. I am a Nar-Anon general representative of a Nar-Anon meeting group. It's a support group for people that have loved ones that have substance abuse disorder.
And I've met this group through Paula Adams, who we've recorded an episode with recently. She's in this support group, but she wasn't able to make it to the interview today.
Yeah, Paula came to my meeting, and like most women and people that come into the meeting, they come in either one or two ways, very angry or crying the first few meetings. And that's okay, because it's the emotional stress of dealing with someone that has substance abuse disorder is hard. So that's how I met her and these other two ladies also.
All right, well, let's introduce you two then.
My name is Becky Wolfenbarger. I'm a retired nurse. I met Marty when Paula asked me to go to a meeting. Paula and Lucretia asked me to go, and that was a change. That's when my recovery started with my adult son that has addiction. I'm not attending the meetings right now. Of course, COVID's kind of changed some things. I would love to get a support group started here in Estill County as well, but we do have some that go from Estill County to Madison County to the Nar-Anon meetings.
And I'm Laura Helvey. I met Marty also through her Nar-Anon group. Someone reached out to me. They said, "Hey, I think your son's smoking more than pot." That's how it all started. And they suggested I go to her meeting. So I did, and we've just become, I attended her meetings regularly. It's a very good support group for people who have a loved one of a brother, sister, aunt, uncle, dad, son, whatever, that suffers from substance use disorder. The family suffers too, and they're sick, and most of the time we don't even realize it. So
when, first question out of the gate is, when you were told that your son's smoking more than pot, what was your initial gut reaction to that?
I had been in denial for so long, but when somebody else came to me and said, "He looks really bad, I think you need to think about this," it made me step back. And I thought, okay, I'll go to this meeting. When I got to the meeting and I heard the stories of the other people, and I said, that's my son. Mm-hmm. And I knew at that moment that he was doing more than smoking pot, And I was fortunate because when I approached him with it, he was very honest with me. And he admitted what he had been doing. And it was meth and heroin. And then my heart sank, because when heroin's involved that it's not, there's only a few outcomes, and it scared me.
Mm-hmm. So then how does that compare to your all's experience?
Well, when I went to a group, I had to drive all the way to Danville. That was the closest Nar-Anon group. I got on the Nar-Anon.org, and that was the closest meeting they showed. And so I drove there, and my first meeting, I went in, and I just wanted someone to tell me what I needed to do to help my son, And when they, well, this meeting's not about your son. This is a meeting to help you to recover. And I I don't have a problem. I'm a nurse. I'm the one that's in control over here, you know. And they suggested I'd come back to a few meetings, keep going, don't just count that one meeting. But I left there and told my husband when I got home, I don't think this is a meeting I'm looking for. But I did continue to go back, and I did read the literature, and I did read everything I could find about addiction, because I wanted to know how to deal with this, you know. Being a nurse, I thought there's a cure, there's something I can do, there's something can make a difference that medical-wise, you know. And I finally, though, reading the stuff, it was like, yeah, this is me. I have got, my whole focus had turned into saving my son, to the point that I was making myself sick. My heart wouldn't quit beating 120 beats a minute. I had to go to the doctor of that. I had to get put on medication, you know, just the adrenaline. I've always been stressed, expecting the state police to knock on my door and tell me my son was dead, you know. The stress of it is beyond belief. That you can't even think straight. You really can't. I'd be driving sometimes and just break out crying, you know. So I kept going to meetings, and I got it. I got what they were saying. I realized I am pretty sick. The rest of my family is not getting a person that is healthy, that is happy, and that's not fair, because one person in the family has decided to go in a way that they wasn't taught, you know. And so I prayed about it, and you know, I kept thinking somebody was going to start a group in Madison County because the problem was so bad. And finally, I prayed about it, and I said, God, if you want me to start this, I don't know what I'm doing, but if you'll help me, I'll do it. And he did. People, you know, stepped up and helped me, and I got it going. And these two ladies were one of the first people to walk through the door, and we just, you know, kind of go from there. And what we found out is, as we helped ourselves to get better, our loved one got better.
Really? Okay.
Yeah.
So I've got one just timeline question. How long was it between the first meeting that you attended before you got the group started?
Probably 4 months.
4 months. Okay, that's pretty quick then.
Yeah.
All right.
Well, that's a long drive to Danville.
It is. How long of a drive is that?
It's about an hour.
Okay.
Yeah. Hour and a half.
Yeah.
So, yeah.
So you mentioned that you all found this. You said that you all found that when you guys were finding your healing together, that your loved ones were also getting better. That doesn't make sense to me.
Well, when I started going to Marty's group, we'd already been dealing with addiction that we knew of for 7 years with my son.
Okay.
I had started counseling because my son came to me and said, "You're broken. Dad doesn't want to tell you. My daughter, that's also a nurse, didn't want to tell me. You need to go get help." And then the counselor kept saying, "You need to work on you." And I'm like Marty said, "I don't have addiction, you know." When I started attending Marty's meeting, the first meeting, I'm going to go here and I'm going to be quiet and I'm going to listen. Well, I spilled everything. The first meeting was ugly crying. My husband who I had started, Marisol was in and out of our house then. And then probably 2 weeks into the meetings, he said, "Something's different about you." And he saw my Nar-Anon book over there, and he let out an oath and said, well, I won't say what he said, and he said, "I'm screwed. Mom's going to meetings now." You know, he had seen the change in me and how I reacted, that we weren't constantly picking at each other, but it's because I was working on my recovery. You know, knowing that I can't change him, but I can change how I react. I can start to get healthier. I can start to be here for the rest of my family. I can start to set limits. You don't realize until you get on the other side of enabling how much, you know, because sometimes it's easier to hand someone $20. It was low then. Now you'd have to have 40 probably for a pill. But just to get him to go out of the house and be quiet. You know, when you have one of your grandchildren speak up and say, "No, bub, you can't have $40, you know, because it was controlling. It doesn't just affect that person. It affects everyone in that family. It just zaps you. When you go periods of time, still today there are weeks I don't even remember some things that happened, because that every second that's what's on your mind. until you start working on recovery for yourselves. And then when you do that, even if your child or your loved one doesn't recover, if they don't go for help, you still are at a good place, so you can know how to deal with it. And you also can step up and start to help other mothers, other fathers, other people that you see in addiction. You can help them to get out of that miserable state.
That makes sense. Yeah. So, and was it like changing your mindset? Do you think that was a part of it? Like, what was
absolutely?
Yeah.
Well, the 3 C's we look at: we didn't cause it, we can't control it, and we can't cure it. I had to keep remembering that.
Mm-hmm.
That first lesson that we have when we realize that it's not our fault. Mm-hmm. When you realize that, it's like, and you can't fix this for them, which is what you constantly keep thinking. Maybe if I did this, maybe if I did that, or if they went to this treatment place, if we could borrow money and send them to this, we can't do that. It has to be them making the choice to get help.
So when your kids saw you guys going to this meeting, how were they responding to seeing you? Like you said that your son was telling you got to go work on yourself. What was the response from the kid that was in addiction?
My son, he was in rehab not long after I started the meeting, and he told me he was so glad that I wasn't letting myself be a victim to his disease, that he, through his meetings and groups, he realized just how bad some of the other guys, the guilt they had to deal with for what they put their family through, how hard it was for them to recover because how bad they felt about themselves for what they'd done. And by me stepping up early and getting help, I didn't let him do the things to me that he may have done if I had just kept on getting sicker.
Mm-hmm. Okay.
Yeah. One of the things that you find when you see someone who's been in active addiction and they're going through recovery is that when they get through, they do the steps. A lot of times they'll go through a step program. Well, Nar-Anon's a step program too, but it's a program for, the ones that are dealing with the sick, people with substance use. And so when the person who's suffering from substance use disorder gets to where they have to realize all of the things they've done to their loved ones, that's the hardest step. Step 4, doing that self-analysis and making amends and those kind of things. And that's the hardest part of recovery for them. It's probably the hardest part of recovery for us too, because we have to do a self-assessment. Who have we hurt just by being so focused on that one individual in your family? Yeah.
That is a big pill to swallow too, I guess, because then you have to imagine that exactly how you're affecting other people.
Right.
They're going to start affecting other people around them as well. So do you guys also have, how many kids do you guys all have?
I have 2.
You have 2?
I have 2.
I have 3.
Okay. So you all had other kids, were they like around in the house when all of this was, like close by at least?
I had at the time my daughter was teenage years, so it was there were situations where she was probably in danger because he was bringing people in the house and they were taking things and he apologized for those things, but yeah, in uneasy situations, even we wouldn't let her friends come to the house if he was living with us because it's not a safe situation necessarily for anybody. So it's it's a struggle, especially with a younger child or even another child in the home. Yeah.
I didn't really realize at the time what I was doing to my daughter. One day when he was in recovery, he'd been in recovery then probably at the rehab for 8 months. One day I overheard her telling her dad, I'm so tired of people asking me how Brian is. How about me? I'll say her name. She's a nurse here at the hospital. Her name's Deanna. How about to say, what about Deanna? She's gone back to school to get another degree.
Mm-hmm.
She's taking care of her home. She's working full time, has 2 children, and working on a degree. And it's like everything's been about him. And every time there was a special day, whether it was graduation, coming to the hospital, my first grandchild was born, and he came there, and his sister looked for him all night. And when he came, it was 2:00 in the morning, and he was very high. So those are things he can't take back. His sister and him have made amends, but it still bothers me at times to know every moment was focused on him. It was a survival thing. I felt like I needed to be there just to be protecting him. That's before I started going to her group.
My daughter, she went to college, she got married, she's got kids, she's done everything right. To me, that was a saving grace for me, because first thing you think about when you find out about this is what did I do wrong? If I done this or this, and and she would tell me, Mom, you were a great mom. He had no reasons to go into addiction. It was nothing you did, it was a choice he made, but it's very hard as a mother. You take on the guilt of it, so when you feel guilty about it, you feel like you got to fix it like you did when they was a kid. You have a hard time separating the kid from this person they have become. When you go to the meetings and everybody, tells their story and stuff, we found very much so that we all sound like we were talking about the same person. Our children were all very different in personalities, but when they became an addict, they became all alike. They manipulated, they stole, they lied so much. They couldn't tell the truth for nothing. They stepped on our feelings, and it's like, you think we're talking about the same person, and you realize just how addiction will take them over and turn them into this person. So you can detach a little better from the person that is an addicted person. You can step back and see them a little different. You can, you hate the disease but still love the person, So you can detach a little bit more, so your feelings are not, you don't take everything personal,
So I have a question for you specifically, Marty, on this. So you've mentioned several times already diseases and choices, and you're coming from a medical background professionally. So you mentioned that it was a kind of a hard thing to come to terms with initially, like that you wanted there to be just a cure for it. What was that experience like, I guess, like wrestling with the science healthcare part of yourself versus what addiction was, and going through that?
I read a lot. I researched it. I read a book called Beyond Addiction, and it was a book about all the research that has been done on addiction, what actually works and what doesn't, and it broke it down so I could understand it as a disease.
Okay.
It's a choice to start with, but it may start out with a choice to have fun on a Friday night, Saturday night. Their peer group, it's out there in the culture, their peer group's doing it. They start out doing it, having fun with it. It grabs a hold of them before they're not doing it, just doing it on the weekend anymore. They're doing it every day, and then it takes them over, and it becomes a disease of the brain. It's a mental disease that affects how their brain works, how they think, the decisions they make. And the younger they start, the more it can change their brain chemistry, So it is definitely a disease. Yes, just like any other disease, you choose to get help for it. You choose treatment, It's just harder with addiction to get to that point where you will choose addiction, because your brain is trying to pull you the other way.
And that book is, what was that called again?
Beyond Addiction.
We're going to put some kind of link to it in the...
Yeah, it's a really good book. It just opened me up to how I could talk to him and his girlfriend in a different way instead of fussing at them. I quit fussing. I quit wasting my time because it wasn't getting through to them. So I just talked to them. I didn't ask them, I didn't lecture them, I didn't tell them you need to do this, you need to do that. I backed up and said, how's your day? How you feeling? And talked about normal things. So my son would, we would have a conversation. When he was homeless at one point, I may meet him and bring food. He would have to eat it in my car because I know he would take that bag of food and trade it for drugs if he could. So most of the time he wasn't hungry. That was just a way to get me there so he could get money from me, which I wouldn't give. He learned that my boundaries were set, and I'd just talk to him and I'd say, when you're ready for recovery, I'm here for you. But I'm not going to support you in this lifestyle that you chose to go into, And I said, but let me know when you're ready for recovery. And I would ask him to pray with me, and then I would drive off afterwards and cry all the way home. You may get help with this meeting, but it's a constant recovery. You relapse, we relapse. We go back to wanting to help them, wanting to do, and we have to rely on each other and rely on the teachings and say, okay, step back from this. Don't jump right back in trying to solve their problems, So it was a difficult time, but the more I read, the more I could look at it with a different attitude.
Okay. Yeah. So you're giving amens over here.
Yeah, because I truly believe that there is a link between in today's culture, we don't know who's going to go out with their friends. I did it. I went to, in high school, I was drinking but way before I ever was 21. I was lucky. I tell myself that every single day because I see Daniel's friends who he did the same things they did. He would go out, drink, whatever. Daniel became an alcoholic. Then he became doing other things and then other things, and it just spiraled until it was the worst possible thing he could do. And I look at his friends, I'm like, they all started the same way. He didn't escape. They did. He become a victim of, and I tell people every day, if you don't think it's a disease, you got to rethink it, because we don't know whose brain it's going to affect. I don't know if there is a genetic link. There probably is. I firmly believe that, because I do believe that some people are more susceptible to becoming a victim of substance use, and we just have to learn to deal with that. Marty didn't do anything. Her daughter, I'm sure her daughter probably did some of the things Grant did.
Well, my daughter even said it, Mom, I did some of the same things Grant did. It just, somehow I didn't go on further. I grew out of it and went on to be an adult. He wanted to stay in that state,
And my older daughter, I know she did some of the same things that Daniel did. But we always knew early on that there was something a little different. He did everything to the extreme. So we saw a pattern in his behaviors that we kind of suspected that, no, you don't need to be drinking at all. You try to Katie bar the door, just don't do any of this, and we were really kind of strict on what we thought we were being strict on him. But, I got one that did really well, one that didn't make it out, and I'm still working on the other. So, but and we talk about it, we talk about how it could be just once that you do something and then it's the end, because that's the reality of it. You don't know if hey, I'm going to take a drink of beer because the rest of my friends are drinking and I want to be cool and want to fit in. And the next thing you know, you're a full-blown alcoholic, because Daniel would tell you, before anything, I'm an alcoholic. That was his first substance that he abused, and that's what he identified as an alcoholic. And so it just spiraled into other things.
And then you mentioned that just one time. Like it might,
Yes.
especially today with
Yes.
the prevalence of fentanyl
Oh,
and
yes.
whatever on earth they can put it in.
Yes.
It's a terrifying.
It
It's a
is.
terrifying world.
Yes,
Yeah.
it is. And it is in everything.
Yeah.
And,
You know, when you mentioned about just telling your children don't do it, and that's how I did with mine. I would, now looking back, and with my grandkids now, say, I'd rather you not do this. Here's things that can happen. With my son, of course, those things weren't tried at my house. Now, later on, I know that he shot up at my house later on, found evidence of that. But when he started with the pills, someone had an oxy, and he took it, and his back didn't hurt. He worked harder. He made incentive at work. Well, then he got to where he was taking 2 of those a day. At the end, when we found out about the addiction, he was taking 6 of the oxy 80s a day, which would kill someone. And then we found out that he had taken our credit card and applied for a PIN so he could get cash advances. And all of a sudden, they were like, it was outrageous. It was thousands, and we found that. That's when it all came out. He went to jail, and then we started processing that. You know, but when you look at, is this a disease? Is this a choice? One of the young men that spoke at one of our recovery programs, he said, choice, disease, regardless, they need help. Because that's what sometimes the stigma in the community and other people, even people today, in my son's 3 years, it's been 3 years of his recovery, still say things that are very hurtful to me. What? Well, didn't you see that he was doing something? Couldn't you have done this? No, that's not how it works. And I pray it never affects your family. Because there were days that I thought it would just be easier just to die than to deal with what I was dealing with. And then I thought, that is selfish. There are other people that I can offer things to. But like she mentioned with the drugs we have now, and the thing is, when addicts hear there's some bad drugs on the street, they don't shy away. That's what they want. It's going to feel different. It might feel like the first time you did drugs. That high that you had the first time, they want that again. They're not going to feel it. And once they've had the taste of heroin, nothing else is going to be as good as that. My son, he would go for months and not do opiates. He could lay those down. But once he started heroin, tried it, he said that was the first thing he thought of when he woke that morning, if he had slept any that night, was I've got to find heroin. I've got to do something to get heroin.
But the drugs out here they're terrible. Fentanyl is in everything. It's in marijuana now, for goodness sake. Pressed pills. We have people dying at an enormous rate, and it's so sad. And until we get a community that works together to decrease the stigma, increase awareness, increase resources available to families and those suffering, then we're not going to combat it. It has to be a total, thing. I can't fix it. I wish I could. And love can't fix it. And I love everybody. But if your love for your child could stop their addiction, it would be eradicated. So we have to do other things.
And as it turns out, these ladies are doing quite a bit. So come back next week to hear about everything that they're doing. You've been listening to The Local Lens. These are our people, using our voices, telling our stories, because no one sees it like we do. But before we cut out, I've got a few thank yous to pass out. Thank you, first of all, to these 3 ladies for joining us today, and thank you to Paula Adams for connecting us. And also a big shout out to the Powell County Health Department and Kentucky Rio for putting the show on, and also thanks to WSKV for broadcasting the show. Alright, that's all the time that we have, guys. Thank you so much. Come again next week. We'll see you then.